Hello, good morning. Assalamualaikum. My name is Shilda Ismail, and you are watching Health Matters. And this show this morning is specially brought to you by Institut Jantung Negara, or better well known as IJN. Okay, we are all aware that COVID-19 is a serious threat, and a new report from WHO ataupun World Health Organization finds that heart disease still remains the leading cause of death globally. So even with COVID-19, with the pandemic, heart disease is the world's most deadly killer. All right, speaking of cardiovascular disease, IJN somehow achieved another milestone. And now they have another new treatment performing a newer and safer method called intravascular lithotripsy. So this is to treat heart patients suffering from severe atherosclerosis. Okay, I don't even know how to pronounce it. I'm not sure what does that mean. Joining us for today's heart-to-heart talk, Sonic Waves, New Hope for Treating Atherosclerosis, I'm honored to have Dato Dr. Amin Ariff Nurudin, Senior Consultant Cardiologist, IJN. Hello, Doctor. Hello. Can you hear me, Doctor?
Hello.
Yes. How are you, Doctor?
Can you? I'm fine.
Yes, I can hear you.
Today we're talking about matters of the heart, which is very important. All right?
Yes. Okay. So my first question is, Doctor, what is atherosclerosis on a layman's term?
Right. Okay. Atherosclerosis in the layman's term is just deposits of fat and cholesterol in your arteries. The easiest way to look at that is like when you have a new pipe, the pipe does not have any sediments or blockage in it. So as time goes on, when you use the tap for a long time, there will be deposits on it. So basically that's what happens to your arteries, where fat and cholesterol is deposited into your arterial wall. And this, in due time, over a long process, can cause narrowing of the arteries, and then you can get reduced blood flow. I think that's what we are talking about. Atherosclerosis causing reduced blood flow and causing symptoms to the heart.
Okay, so what are the conventional ways to treat patients with atherosclerosis?
All right, I think the most important thing is lifestyle changes or healthy living. I think that is the most important thing that you need to do. A healthy lifestyle, and also a diet that is not too rich in cholesterol. I think those are the most important things that you need to do. All right. Because by the time you have all these deposits in your artery and where we have to treat, I think we have missed an opportunity for a majority of our patients to have a healthy lifestyle before that, leading that to come to our doorstep. I think prevention definitely is the way to go. So healthy lifestyle and good diet.
Okay, Doctor, I understand that you have some slides ready for you to explain to our audience this morning. Perhaps you can, suggest us what are the, medical latest news on. All right, what is that? Balloon angioplasty.
Okay, maybe can I show you the slide of how your artery gets more and more narrowed?
Yes, gladly. Silakan.
Okay, so basically, if you look here, this is a clean pipe, all right? This is where there's a bit of deposit. Can you see what I'm showing? There.
It's on the left or on the right of the screen, Doctor. Okay, there you go.
Can you see my cursor? All right. So this is a very clean artery. This is what we want most patients to, or most of our public to have. A bit of deposit doesn't cause much problem, which can start from your second decade of life, and that can progress to cause more narrowing and more deposits of plaque. Plaque actually is deposit of fat and cholesterol in your artery. And then you come to this final one where you can see the lumen, or the amount of blood that can flow here compared to here is very much reduced. And when you have this a lot of this plaque, what happens as the plaque progresses, it becomes hard, and we call that calcified plaque. I think this technology handles this hard calcified plaque. I think that is what we're talking about. And I must say that this sonic waves does not replace ballooning and stenting, but it's something to aid us to put in a stent. If you can imagine, if it's very hard, it's very difficult for you to sort of open up this artery using a normal balloon. It's just like if you have stone, you put a balloon and try to to crack the stone with a balloon, it's not going to happen. So this new device helps us in that. Maybe I can go to the next slide. Okay, as you can see, the plaque build up, it starts from the second, third decade of life. So if you do not have a healthy lifestyle, and if you're under a lot of other things like stress, if you have other risk factors like high blood pressure, diabetes, this can progress quite quickly. So this is the thing that we would try to avoid initially, so that the plaque build up does not occur up to this stage. Can you see my cursor?
Yes, I can see you.
All right. So if you look at this, the traditional way is ballooning it up, meaning that if this plaque or this narrowing is soft, meaning that it's not hardened, you can put a balloon across, you can inflate the balloon and push this plaque to the arterial wall. So if you look at the lumen here and the lumen here, the flow, of course, here is only this much of 50% or less flow here of blood, whereas here the flow is much better. So this is the traditional way of treating. Earlier on, balloon angioplasty, but then later, as things progress, technology progress, after ballooning, because if you just balloon and do not put a stent, it may re-narrow down quite quickly. So later, stents are the mainstay of treatment. It means that once you open up, you balloon, you push the plaque to the side, you put a stent so that this narrowing does not recur that easily. And this is the standard treatment. And even with this new therapy, we still have to balloon and stent the blocked arteries. Okay. So I think these are the first 4 slides that I would like to show. I think you have a sort of a video to show.
Okay, so now as we have, if I've already introed this morning, so IJN has successfully performed a new procedure, a technology called Intravascular Lithotripsy, IVL, and I'm sure a lot of people wants to know about this, to treat patients suffering from severe atherosclerosis. So perhaps you can tell me more about IVL, Doctor.
Okay. The simplest way to look at it is, if you look where this IVL has been used before, is in the kidney, where people who have kidney stones. So one of the ways that they sort of break up these stones into very small pieces, and then it just comes out. So that is the principle of it. But of course, in the arteries of the heart, it's slightly different. What the principle is the same: sonic waves. You give in spurts of every 10 seconds, and this breaks up these very hardened arteries where there's a lot of calcium, calcified arteries. So when you break up this calcium and crack it, then it will make it easy for you to balloon and put a stent after that. So in the past, when this technology was not available, there are 2 other technologies that sort of reduce the calcium. One of it is what we call rotablator, where you sort of put in a diamond-studded drill to shave off the calcium, and this goes down the artery. There's another newer one, which is orbital atherectomy, which also has the same principle. But this other 2 procedures are a bit more detailed, and you need some skill to do it. And if you can imagine, all these tiny particles that goes down with these 2 procedures is going to go somewhere, right? So there are a lot of complications that may occur. But I think with this new sonic procedure, there's minimal amount of calcium that goes down the artery. And what you do, you crack the calcium, the hard calcium, so that you can balloon up and balloon it up and put a stent. So I think it is something that don't get too excited, because people think that by doing this you don't have to put stents, you don't have to go for bypass surgery. No, the answer is no. But definitely for those very hard lesions where you cannot open up with a balloon or the other devices, this is something that will do it. And the good thing about this is very safe. It's very safe, and it is something that most people, most interventionalists or your heart doctors that do this procedure can do it very safely, and the complication rate is very low. So this is something that is quite exciting for these very highly calcified lesions.
Okay, so again, I'm sure those out there listening on our program this morning, I'm sure we want to know what is what we know, conventionally, the balloon angioplastic. If heart attack, or we're about to be hospitalized because what's the difference between balloon angioplastic and also sonic wave? In the easiest way terms that you can tell us.
Let's put it this way: you have to do both of them together, right?
Okay, right.
So what this sonic, this IVL does, helps you to open the vessel better. That means the blockage, because if you use the balloon in the first instance, because the narrowing is so hard, the balloon will not be able to open. So you put this sonic balloon, so you crack up the calcium, and then later you use the normal balloon to open it up, and finally you stent. So it's one of the things that we do for angioplasty and stenting.
I see. Okay, so we have a video somehow that we can show for the audience with regard to the sonic wave. Let's just take a look at that.
Sure.
The shockwave intravascular lithotripsy system creates pulsatile sonic pressure waves to modify calcium in a safe manner. It consists of a compact rechargeable generator, a simple connector cable, and an intuitive catheter, which houses an array of lithotripsy emitters enclosed in an integrated balloon. Through the localized delivery of lithotripsy, the IVL system minimizes trauma, optimizes outcomes, and simplifies procedures. In a standard technique, the IVL catheter is advanced and placed at the lesion using marker bands under angiography. With the integrated balloon expanded to subnominal pressure of 4 atmospheres by a mixed saline and contrast solution, the fluid within the fully opposed balloon acts as a coupler to facilitate efficient energy transfer of the sonic pressure waves into the vessel wall to reach the calcium. The generator produces 3 kilovolts of energy that travels through the connector cable and catheter to the lithotripsy emitters once per second. While other treatments can't differentiate between calcium and soft tissue, acoustic pressure waves pass through soft tissue to impact both intimal and medial calcium. With emitters along the length of the balloon, a localized field effect is created. A small electrical discharge at the emitters vaporizes the fluid within the balloon to create a rapidly expanding bubble that generates the sonic pressure waves and then collapses within a few microseconds. When the waves impact the calcium at nearly 50 atmospheres, they create a series of microfractures. After the calcium has been fractured and trauma to the surrounding soft tissue has been minimized, the vessel becomes more compliant. Once lithotripsy has been completed, the operator can proceed with the preferred treatment strategy to optimize outcomes. By making the treatment of calcified lesions more predictable, IVL is simplifying complex procedures.
Okay, doctor, my next question is, what are the post-operative care tips for the patients who have undergone the IVL treatment? What is the downtime, for example, with someone that done the surgery, etc., etc.? Perhaps you can explain to us, doctor.
Okay, I think firstly, it's not surgery, it's just balloon angioplasty. So in fact, if you use this procedure, you spend less time using the other 2 devices to get rid of the calcium from the artery. So it is just like a normal balloon angioplasty. So the time is exactly the same. In fact, it is shorter in those patients who have blocked arteries that have a lot of calcium in it. So it's just like a normal balloon angioplasty stenting. So if you talk about that, it can be as short as half an hour, 1 hour. It depends on how long the narrowing is. So it's not going to change the period of time that you need to do angioplasty and stenting, but actually it shortens the time because you do not have to use the other devices, which have a lot of other equipment and a bit more of complications in the other devices that I mentioned. So it's a very safe, and you don't need very much skill. If you can do balloon angioplasty, it's just putting a balloon there and connecting to shock wave. And this is something that a lot of the interventionists can do, and there's no special sort of training that you require in it. So this is something that is good and safe and does not cause many complications like perforation of the artery, right? No flow down the artery. So these are things that may occur with the other devices. So just like normal balloon angioplasty and stenting.
Okay, this is done in IJN. I'm sure there's some success stories behind IVL in IJN. I'm sure you'd like to share with us, Doctor.
Sure.
Any of your patients? Yeah.
Yeah, I think the first case that we did was last week. So looking at what we do is that to see whether there's a lot of calcium in the artery, we put down a camera. There are two ways of doing it. One is an ultrasound. The other one is what we call an OCT, optical coherence tomography, where it's a camera down and we can see how much calcium there is. If there's a lot of calcium and we know that the balloon is unable to crack this calcium, then we use this technology. And basically, there was another case also done where this patient has got, his artery is just full of calcium. It's just like, there's no way that you can balloon and stent without cracking the calcium. So, and even when there's a lot of calcium, the bypass also may be a problem. So this device actually simplifies things of how we open the artery. So I think this is, there will be a lot of other cases that I think even the cardiology fraternity that will report that they find that this is something easy to use and produces very good results compared to the other devices that we use so far.
Okay, fantastic, Doctor. I have some questions from the members of the audience. Okay, one question. I have a stent installed roughly 1 year plus ago in one of the main arteries near my heart. What I want to know is whether there is a need to take blood thinning medications through my life. Okay, perhaps you can answer. And then the second question will it be more expensive than the normal angioplasty?
All right.
Okay, go ahead.
All right. The first question, lifelong. This is what we say, sehidup semati lah. So I don't think anything you can do. You will have to take a blood thinner for the rest of your life. But usually after a stent, you are 2 blood thinners or antiplatelets to be more correct. So after a year, usually you're stuck to one, and most of the time it's just aspirin. So it's just an aspirin a day, maybe keeps the doctor away. Okay, so you have to take that, including your other medications for your cholesterol and all that. So I think, yes, you have to take for the rest of your life, but don't be too sad about it. You just sometimes take vitamins every day anyway. So, right. So now, okay, this procedure is only for very highly selected cases. So if you use the other devices that I mentioned, the rotablator where you drill down and the orbital atherectomy, there are also added costs, the equipment and whatnot. So this is just a balloon, the cost of the balloon, and the sonic wave is just a small machine. So if you put all the costs in, I don't think it's going to be much higher than those who have undergone rotablation or atherectomy and put a stent in. Okay, so of course you have to factor all those costs, and with any new technology, of course, with due time, when a lot of people use, when the volume is high, the cost will come down. So very highly selective cases, not for everybody. I think most of the patients can just get with ballooning, angioplasty, and stenting. I hope that answered this question.
All right. I have one more question here from Michael. He says, please explain what is single vessel disease.
All right. Okay, your heart has got three big arteries, two on the left and one on the right. So if it's single, it's one out of three lah. Bukan tiga dalam satu lah, satu dalam tiga. So it's one out of three. It's single vessel. If you have blockages in two arteries, two vessel lah. Kalau both three, triple vessel. Okay.
Okay. All right. Any more questions from the member of audience? Member of netizens? Okay, kalau tak ada, so anybody who would like to know more about this, you can go log on to our to IGN website, which is www.ign.com.my. All right, Doctor, I would like to ask a question. This is heart-to-heart questions. Please share some health tips. The Malaysian style. I understand that our diets in Malaysia, you know, we have our nasi goreng, pisang goreng, the lovely, you know, delicacies. You know, what are your advice? You know, how do we avoid cardiovascular issues, Doctor?
Okay, my wife always complains that I go to the mamak shop. So I'm just like the rest of you. I think there's certain things that the favorite pastimes that we have. To say not to go to enjoy this nice rich food is, I think there's not much of quality of life. So kalau ini tak boleh, itu tak boleh. If you tell patients semua tak boleh, dia kata baik mati doktor. Kalau
yes, it's true. Yeah.
Basically, I think moderation. Meaning that if you have to eat, pergi kenduri ke nak makan lah. But that should not be your normal diet. So moderation, the normal diet should be a balanced diet, not too high in cholesterol, enough vegetables, enough protein, and what is more important actually, a healthy lifestyle. Meaning that burn calories. Go make sure it's recommended that you exercise 5 times a week, which I think sometimes when you tell patients, they say, satu hari pun susah, you want me to exercise 5 times? That's not possible. I think start slow, exercise whatever you can, go for walks. I think one thing about the MCO is I've seen a lot of people exercising because I don't think so that's the plus point of MCO. Okay, so exercise. So brisk walks, jogging, swimming, whatever you like, bicycling and whatnot. So exercise as much as you can. So, but the exercise that you have should be, you should push up your heart rate. Don't just go leisurely walking and gossiping. Okay.
Yes, betul. And
walk up a slope, brisk walk up, make sure you push up your heart rate to about 130, 140. Do it a few times during your exercise. That helps the heart. And in a way, it also sort of reduces the narrowing in the arteries if the narrowings are new. So you can see the advantages and the benefits of exercise. Of course, there are other things that if you can, if you have diabetes, control your diabetes well. If you have high blood pressure, control your high blood pressure well. And stress is one of those factors that sometimes can also increase this atherosclerosis. So try to avoid stress. But I think not everybody is stressed staying at home. Okay.
It's hard to do it, but you just have to be reminded that, you know, the more you are stressed, all the cortisol will start to come in, and you know, and that will probably be the contributor to, you know, whatever diseases, you know. Okay, all right. Will there be any more questions coming up from the members of the floor, members of the audience today? If not, then probably that's all we have for this. Okay, what causes irregular heartbeat?
All right. So irregular heartbeat, the ones that you need further attention is what we call atrial fibrillation. I think it's a whole topic by itself. I think maybe you can have another Facebook with one of my colleagues who is the electrophysiological consultant. I think it's an interesting topic. And that is one of the things that the reason if you have this atrial fibrillation, you have to take certain medications so that blood clots do not form in the heart that may go out and cause a stroke. So I think that is something that another session that you need to check. But just consult your doctor, do an ECG. If they diagnose atrial fibrillation, then you need treatment. Of course, there's also irregular heartbeat where people have missed beats or extra beats. So that is different. So get some advice from your doctor.
Okay, I think we can just take one more last question. Can we take 10 mg cholesterol tablet daily to manage our cholesterol, Doctor?
All right. You have to see your cholesterol levels, and we have a risk scoring system. Whether you have a family history of heart disease, whether you already had a heart attack, whether you are just by routine examination your cholesterol is high. So based on that, only we sort of advise you to take medications if lifestyle changes and diet does not help. And with that, there are certain targets that we need to reach. If you already have a heart attack before, the targets of lowering your LDL, the bad cholesterol, was much lower. If you just have a high cholesterol, a family history of high cholesterol, you do not have other risk factors, it might not have to go down so low. So 10 milligrams might work in some groups, 10 milligrams might not work in other groups. But if you think you can just take it and enjoy your mama food and don't exercise, I think that's not the way to go. Okay.
Yeah. Okay, I think that's all we have from the questions coming from the netizen, and I bet will be our maybe not the last live show with IJN with Dr. Amin. Okay, thank you so much, Dr. Amin Ariff Nurudin, for this sharing session. Yes.
Just one message, two things. Healthy lifestyle and balanced, moderate diet. I think kita jaga jantung kita, right?
Yeah, okay. Jantung ni is the central of everything. Okay. All right, that's all. We have so much. Thank you so much, Dr. Amin. We'll see you again. All right, awareness is the greatest medicine, the fight against cardiovascular disease. For the audience out there, always love your heart. Heart of heart from Shilda Ismail. Assalamualaikum. Thank you.
Waalaikumsalam.
Okay dah.